81% of healthcare workers think government cuts have damaged health services, and more, 86%, believe the cuts have made it harder for people to get the care they need. The Public Service Association surveyed nearly 1,300 healthcare workers and says the results lay out in stark detail that the government's promise that cuts would not impact frontline health services is blatantly false. Well, I'm joined now by National Secretary for the PSA, Fleur Fitzsimons. Kia ora, Fleur. So clearly a lot of discontent in the workforce that you've found there, but the government's come back to us today and said this is just about cutting bureaucracy and that the clinical workforce has actually grown by more than 2,700 staff in the 12 months to September. So what's your response to that?
Well, kia ora, Samantha. Our response is that that's not what our members are seeing. Our members are not seeing an increase in the resource in our health sector. They are seeing cuts having a damaging impact on patient safety. They are seeing, for example, social workers needing to work as receptionists. They are seeing schedulers being overworked so that theatres aren't full to their capacity, adding to waiting lists. So what our members are seeing at the coalface in hospitals is very different to this rhetoric we're hearing from the government. And we really encourage the Minister to read this report, to listen carefully to the health workforce and to lift the hiring freeze and to fund our health sector properly, because that's what all New Zealanders deserve.
That's interesting because the Te Whatu Order is saying that there is no hiring freeze, that this is just about cutting non-frontline staff and that it shouldn't be affecting frontline services.
Well, that's not what our members are seeing, and this survey took place as recently as late January. In fact, one of the participants in it said, I'd love someone to come to my team meeting and tell us that there hasn't been a hiring freeze because there are fewer people doing more work than ever before. So it's just not the reality. So I would love to see the Minister and Te Whatu Order issue a clear, unequivocal statement that there is no hiring freeze and that vacancies can be filled, because that would take the pressure off tomorrow. But we also need to see an overall increase in our funding of our health system.
Fleur, 4 out of 5 respondents to your survey say that they're unhappy with the government's cuts. What are they saying exactly about the impact on them, both professionally and personally?
Well, it has got morale at rock bottom, but people are also raising real stories about their inability to deliver patients the care that they need. For example, there's somebody who works in cancer treatment. They're a dietitian. They would see a cancer patient before they would have their stomach or esophagus removed and talk to them as a dietitian, give them advice, give them support. The message they've put into the survey is that they can't do that because they're too busy covering another dietitian's work. We're seeing stories like that around stroke patients not getting the rehabilitation they need, lip and cleft palate children and babies not getting the surgery they need quickly enough. It's many, many stories of this nature that mean that people's outcomes in life are worse, that patient safety is worse, and it's really because the government is prioritising saving money over saving lives in a quality public health system.
There is an argument from the government that there has been significant overspending and it needs to save around $1.4 billion. So what do you propose as a solution?
Well, actually, a health system costs what it costs to run. And government need to understand this and commit to properly funding it. They made a choice to give landlords massive tax relief instead of New Zealanders the health system they need and deserve. And if Simeon Brown's serious about efficiency in our health system, he will read this report and he will take it seriously and he will act on it.
Thank you so much for your time. That is the National Secretary for the PSA, Fleur Fitzsimons. Tēnā koe. Now, we have heard from Health Minister Simeon Brown in response to the PSA's survey. Now, in a statement to 3 News, he didn't address the PSA's call to stop the cuts, but said the government was refocusing the health system to deliver better services and outcomes for patients. And Dr Nick Chamberlain has also responded, saying the organisation values the voice of staff, but argued there is no hiring freeze, and with a workforce of over 90,000 highly skilled and experienced staff, workforce numbers do often fluctuate.